Good morning, guys. So I know a lot of you are working out with a physical therapist. Maybe you have access to a fitness facility. If you have a standard bench, now you don't need this. You can absolutely do these with a chair. My concern with the chair or anything that you're using is that it's a stable surface that you feel comfortable and you know will not move. My concern with benches, for example, is if I'm trying to push myself up, maybe it's early in the rehab process, I would be concerned that the bench would slide or that the bench would tip. So one of the things that I typically have my patients do is, if they're new in my physical therapy clinic and they haven't been working with me very long, I'll have them turn, straddle the bench, and then take a seat backward this way, as opposed to sitting sideways. So in this position though, what's really great about this is we know that in order for me to get up from a seated position, I need to move my center of gravity forward. If I had a right total knee replacement in this case, you guys can see from the video, I'm not anywhere near 90 degrees of flexion. So if I needed to get up from this position, my goal is to get my center of gravity forward, to get my nose over my toes. And one way I can do this from a bench like this is to lean forward and just work this rocking motion, so that as I feel my center of gravity getting forward, from here I've got my hands on the bench. It's very easy to stand and start to walk, but then it also gives me a chance to find the balance point so that I can control the descent. After a knee replacement, one of the most common concerns is when somebody's sitting, they're going from standing to sit, they get down about halfway and then they drop back into the chair. So to avoid that, what we need to do is we need to figure out where's the center of gravity, how much forward can I lean to allow myself to drop down in a controlled descent so that, heaven forbid, the chair would slide or something would move, or I don't know. We just want to keep you as safe as possible. A lot of therapists will tell you, don't reach for the walker. You can't pull yourself up from that. They want you to be able to get up independently and then use the walker. A lot of patients will try to push up from behind them, but now they're going backward instead of going forward. So the main objective in a drill like this, an exercise like this, is nose over your toes, get your center of gravity moving forward. Come forward as much as you can, even if you're just lifting your hips an inch or two out of the seat. That's the hardest part, because once you get that first inch, the rest of it now becomes easy. Guys, I hope that was a helpful little tip. I'll see you on the next video.